Okay, this video is about the septal hematoma. When we consider this as a diagram of the nose, so we can see this is the nasal septum, and nasal septum is made up of bone and cartilage, and these coverings of bone and cartilage, we know they are called as pericorneum for the cartilage and periosteum for the bone. So what happens is, during any trauma or any surgeries, there is collection of the blood between these layers, that is a pericorneum and periosteum, and between the bone and cartilage of the septum. So this is called as septal hematoma. So on examination, what happens is, we can see a smooth rounded swelling, and on palpation it is fluctuant and it is often soft. Okay, so what is the treatment for small hematomas is aspiration with a wide bore sterile needle, and in large hematomas what we do is we give a incision from anterior to posterior. So if this is the lateral view of the nose, we give an incision like this and we drain the septum. Okay, larger hematomas are incised and drained by anterior-posterior incision parallel to the nasal floor. Okay, excision of a small piece of mucosa from the edge of the incision will give better drainage. Okay, following drainage, we should pack the nose to prevent the reaccumulation of the blood. Okay, what are the complications? Whenever this is not drained, it may get fibrosed. Okay, it gets thickened. Permanent thickening of the septum can be seen. If there is a secondary infection, like any bacterial infection or anything, there will be there may be necrosis of the cartilage, and there will be depression of the nasal septum, nasal dorsum, and also it may turn into nasal abscess if there is necrosis of every parts of bones and cartilage. Okay, this is about the septal hematoma.